Ligation of the proximal patent ductus arteriosus will be performed close to the pulmonic end. A tie is made around 2 to 3 millimeters above the origin of the left pulmonary artery to avoid the left pulmonary artery stenosis. Transect the main pulmonary artery at the midpoint between the sinotubular junction and the base of the right pulmonary artery. Create a small oval-shaped patch, which will be sutured at the confluent branch pulmonary arteries. This patch will help prevent stenosis of the pulmonary artery origin. Transect the PDA and residual ductal tissue at the descending aorta end. The coarctation ridge and isthmus are excised. Cut a straight incision on the anterior wall of the descending aorta. Cut an inferolateral incision along the lesser curvature of the aortic arch, which extends towards the ascending aorta and down to the sinotubular ridge. Begin to anastomose between the posterior wall of the descending aorta and the posterior wall of the aortic arch. The starting point of the suture is at the center of the posterior wall and should be completed in 2 steps. The back wall anastomosis should result in a widened posterior wall. Cut a long oval-shaped patch. The width of the patch should be 1.5 times the diameter of the descending aorta and at least the length of the lesser curvature. The patch is usually cut longer than this and trimmed later. Anastomose the distal tip of the patch to the descending aorta incision. Begin the suture 1 stitch away from the apex of the incision and continue to suture the patch along the inferior wall of the descending aorta. Trim any excessive edge at the descending aorta. Continue to suture the patch along the descending aorta towards the aortic back wall anastomosis. Then lock the suture before carrying on. Continue the suture along the inferior wall of the aortic arch to the distal aortic arch between the 2nd to 3rd head and neck branch. Switch to suturing the patch on the anterior wall of the descending aorta toward the other end of the aortic back wall anastomosis. Then lock the suture. Continue the suture along the anterior wall of the aortic arch to the distal ascending aorta. Suture along the anterior wall to the same point. Continue the suture from the inferior wall of the aortic arch to the proximal ascending aorta. Trim any excess on the patch. Continue the suture towards the apex at the proximal ascending aorta and back to the anterior wall of the aortic arch. The suture should continue until the site of expected pulmonary implantation. Before closing the suture, probe to ensure the patency of the augmented ascending aorta and arch. If necessary, trim the distal pulmonary artery to the appropriate length before being reimplanted to the patch. Using forceps, hold the pulmonary root up against the patch to identify the location of the incision that needs to be made on the patch. Make an incision on the patch that will be used to attach the pulmonary artery. Extend the incision to make a long, oval-shaped hole with the same circumference as the pulmonary artery end. Start anastomosing between the posterior wall of the pulmonary artery and the posterior wall of the patch incision. Switch to the other side and continue the suture between the anterior wall of the pulmonary artery and the anterior wall of the patch incision. Then tie the suture. Finally, complete the patch anastomosis of the ascending aorta. The relationship between the aorta and pulmonary artery is maintained while achieving a widely patent DKS anastomosis with no distortion of the small native aortic root.